My name is Andrea Huebner, and I'm a pediatric neuropsychologist at the Mayo Clinic Children's Center. I'm going to be talking with you today about academic concerns in children, which sometimes might be characterized as a learning disability or a learning disorder. Most children at some point in their schooling will have challenges in their education. And in fact, this is really the way we want it to be because we want kids to be sufficiently challenged. Otherwise, we're setting the bar too low for their development. But there are also a subset of children who really struggle throughout their education at a different level than their peers. And these are kids who are putting in good effort and who have good educational support at home, but who just struggle to master concepts and to learn new things. And these are the children that we might characterize as having a learning disability or a learning disorder. Parents are sometimes very dismayed when their children have learning problems because we often relate academic achievement to potential career opportunities and life success. So it can be troubling when you see your child struggling. Fortunately, there are lots of things that we can do to help, and we do live in a day and age where there is lots of good treatment available if we can get these children identified early and get them the help that they need. And often this helps to avoid years of struggle in school as they move through toward graduation. So parents will often ask, what are the early signs of a learning disability, and how might I know that my child would be one who would go on to struggle to learn? So these signs can be difficult to spot because having just one or two of them is probably not meaningful, or it can be a sign of some condition other than a learning disability. So it's important to take a measured and cautious approach when you're thinking about your young child and how his or her development is progressing. But the things that we often see associated with later learning disabilities are things like delayed speech and language development. So kids who talk later, and even after they do develop language, their sentence structure and the length of utterance is what we call it, is much shorter than other children. They also might have difficulty in their fine and gross motor skill development. Sometimes children will have trouble with following directions or just understanding basic kind of learning concepts. Vocabulary that they might have heard many times just doesn't seem to stick. A little bit older, when we're looking at kids who are preschoolers, these children might have difficulty remembering the names of letters and numbers. And they also might have difficulty with doing like early literacy skills like rhyming. So those are some of the things that we see. But again, it really would be a combination of those skills that would signal the possible presence of a learning disability rather than just one or two of those characteristics.